Hi, welcome to Foundation 96. This is our 10th year, which is pretty exciting. And we've now got 1,196 health professionals that are qualified and experienced in cancer care. So this year, what we'd like to do is introduce all of these people, which might be a bit brave, might be over a few years. We're going to try and introduce you all. So all of the oncology medical team and the cancer survivors know what treatments we can offer to reduce their side effects. It'd even be nice if we could do that at the time of diagnosis. So, time to educate everybody. And the first person for our video team, I'd like to welcome Allyson O'Brien, and she's located in Canada. So Allyson's a highly qualified clinical aesthetician, boasting multiple certifications in nearly 2 decades of experience, specializing in oncology aesthetics, advanced skincare, and nutrition. She's the founder of Allyson O'Brien Nutrition and Advanced Aesthetics. Her passion for radiant skin has led her to work with cancer patients since 2013. She currently serves as an educator for Oncology Training International. As she pursues her nutrition degree, she aims to integrate skin health with gut health treatments and effectively address challenging skin conditions for her clients. With a celebrity clientele and a background in spa management, operations, and education, Allyson's ultimate goal is to help everyone with glowing skin. So welcome, Allyson.
Thank you.
Explain to us, what is a certified oncology esthetician?
So it is someone who specializes in working with cancer patients. We are have gone through a extensive training on being able to be certified and insured to work with cancer patients during their treatment, post-treatment, and everything in between. So to give you kind of a breakdown as to how it works, we are trained to obviously look out for skin conditions, work with neuropathy, work with the oncology team on what is, let's say, have a port inserted, how to work around the port, how to work with if they've had lymphatic issues or lymph nodes removed, how to move the lymph to the other side of the body so it does continue to drain, PICC lines, all kinds of sorts of things.
What evidence you have in your field to be able to share that with people?
All the skincare I use, it's got clinical studies behind it on the ingredients, how they work separately and how they also combo together. But I find that when I'm dealing with my especially my oncology patients, is that it's really important for them to understand that I'm not just putting them on a regime that everybody else is on.
Yeah.
It's very specialized and it's very, very tailored to them.
What would you say would be your most important side effects if someone was experiencing that you know you get good outcomes with?
Um, Well, getting their glow back in their skin's number one, and that's kind of the most like standard basic, thing that I can 100% say. Skincare in terms of the treatments has to kind of be in a tiered system. And then so dermaplaning or my oxygeneo facial, the 3-in-1 super facial are kind of my two go-tos in terms of trying to get those serums absorbed into the skin, giving that glow back, giving the rehydration back, really nice soothing creams for the body, with a really light application if they're going through treatment or, lymphatic issues or, anything like of that. And I think that's kind of the number one thing I would say. Now, in terms of when they go into their skincare and yeah,
Oncology Training International in
yeah,
Canada.
yeah.
Just let us know a little bit more about that role. It sounds like an exciting role for you to be involved in.
Oh, I love it. So I think it's teachings in my blood, and I just absolutely love standing in front of people and being able to teach them something that is going to be able to amplify not only their practice, but be able to amplify other people's lives as well, including theirs. You know, I bring quite a bit with Oncology Trainer International. We, you know, all have come to love Miss Morag, and she is the founder of it, and she is just wonderful woman. I came on board with them as one of the Canadian educators last year, and it has been so amazing being able to sit with these students, hear their stories, either them dealing with cancer and them wanting to find a different avenue to help others with cancer, which has been so impactful to hear about. Or I have just other ones who have had patients come to them and clients come to them and being like, I have cancer. What do I do? And they've just wanted to be able to help those people.
So in closing today, is there something you would like to share? Is there something I've left out that you believe would be important?
I think one of the biggest things is you know, getting the word out there and spreading the word that, you know, there's people here to help. There's people here for the caregivers as well. And that's, I think, one thing that a lot of people don't think about is how much the cancer patients going through it now, but think of the caregivers. The caregivers are hugely important. Just being able to allow the patient to understand they don't have to be scared about going outside of what their oncologist has given them in terms of their treatment. You know, I'm very big on stick to the plan of what your oncologist, because they're the ones that are, they eat, sleep, and breathe this. Stick to what they've given you, but you can, like, aesthetic, you know, oncology aesthetics, oncology massage, lymphatic treatments, you know, oncology nutrition, you know, things like that. So that, I think it's just encompassing such a bigger base on being able to expand to for their well-being and their healing and getting through their experience with what they're going through. I think that's hugely important. And
I do appreciate the time. And if you want to get in contact with Allyson, you can go on to foundation96.com and you can find her on the service directory. And if you're not in Canada and you're somewhere else located, then search the places in our bar. It's not a Google bar, it's a search bar in our side of our system. So it's inside Foundation 96. And then you'll be able to find that person that offers the same services as Allyson and may even be trained with the same professional company, so you know that you're safe. So thanks for today. And I appreciate you being the first person. This is the trailblazer. It's always good to mention it, of us trying to connect the medical team with the cancer survivors with solutions for side effects.